compliance. Then Nalan will go through the contracts and compliance requirements for 22-23. And the outreach team will walk you through our new initiative, which is the 22-23 Outreach Service Funding Process and Timeline, contract period, assessment criteria, and the application form. Then Sarah will go through the other updates and next step, and followed by the Q&A session. So as you sort of seen the team earlier on, we have our senior manager, Joe Willett, overarching seeing both team, outreach and recruitment, and myself. We have in the outreach team, we have myself, Georgia, Candice, and Sarah, and Kaz supporting the team. Obviously, in the contracts and compliance section, we have Nalan and Bettina as well. Just an overview of the outreach program that RWAV administered on behalf of the Commonwealth Department of Health for next financial year, and that includes the Rural Health Outreach Fund, RWAV program, and we have the Visiting Optometry Scheme focusing on both Indigenous and non-Indigenous population in Victoria. And we have a series of programs funded under Aboriginal and Torres Strait Islander programs, which include MYCDP, the Medical Outreach Indigenous Chronic Disease Program, Healthy Ears, Better Hearing, Better Listening, Eye and Ear Surgical Support, and latest edition, which is the follow-up Ear and Hearing Health Services. I'll now hand over to Nalan just to go through the contracts and compliance requirements for 22-23. Thank you.
Thanks, Shub. Hi, everyone. Nalan again. So basically, the contracts, there's two parts to a contract. Whenever you get a contract that'll come to, we use DocuSign at this stage, which will be the digital signature system. There'll be two parts to it, which will be the funding agreement and the schedule to funding agreement. So the funding agreement is an umbrella agreement, and it's your T's and C's that covers all the schedules. And your schedule to the funding agreements are individual services, basically. So it'll be if you have, for example, if you have a pediatrics contract and if you have a psychiatry contract as well as part of your organization, you would have, there'd be two separate services. So this will include the what you're eligible for, the costs that are eligible, the location of the service, how many sessions there are, and what time period. So essentially the term of the contract. So we request that you please read and sign these within 2 weeks of receipt. The term of the contract at this stage is 12 months, with our view that we will be extending these some of them out to a 2-year contract. The contracts are reviewed before the end of the term. Next slide, please. So we request that you send through your proposed visit dates. So these are the dates that you're planning to attend the sites. So if you can provide a list of the visit dates for the contract period, this will be requested after execution, so after signature of the contract schedule, which is the individual services. So the visit dates will need to be provided and cannot include visit dates prior to the execution of the contract schedule. So basically we request that you sign your contract and then you forecast what your service dates will be that will be coming up. So please notify RWAV of any visit cancellations prior to the date of the visit. If 2 consecutive visits are cancelled without notification, RWAV will reach out to confirm if the service can be performed to expectation. So this is a view that we have basically, that if the services can't be performed, then we check in to see if there's a bigger issue, whether, for example, the service provider is left, etc., that is stopping the service from being performed in the year. So unclaimed visits older than 1 month will be cancelled after consultation with the contract holder. I can't stress that enough. We do send through aging emails in regards to follow up any service reports that haven't been received. And this is when you provide us with your proposed visit dates, we track our aging for 30 days and we expect the service reports to have come in. If not, we get in touch with you. Next slide, please. In terms of the service requirements, so essentially last year we actually moved to a portal system where all service reports were submitted online through the portal. So claims can only be submitted after the funding agreement and the schedule is signed. So you'll need to sign both documents before your contract is executed to show up in the portal. service reports are due within 1 month of the completion of the service, as mentioned previously. So you'll have a list of services. Please choose the correct schedule reference and service type, whether it's an on-site or off-site service. If your service has changed for any reason whatsoever, please let us know so we can change. If it's only an on-site service and you suddenly decide to do off-site telehealth visits, we can change that to incorporate the dual service. Please include the invoice number or the invoice reference number. So that if for people who've used the portal, know that there's an attachment menu in the portal. You can attach an invoice, and there's also basically a notification where you can write in the invoice number. The key to this is if you put in the invoice number, it's for your own reconciliation purpose, because what will happen is that invoice number will be entered on the remittance advice. So it'll allow your accounts team to easily reconcile what the payment invoice it relates to. Include all the service data, example, the number of patients seen, and the number of Aboriginal and Torres Strait Islander patients. So these are for the current visits. For any future visits, if you want to do an extra visit as an example, this must be approved via an expression of interest application, which is actually available on the RWAV website. So you actually register, for example, if you have 5 visits on the contract and you think you can do 2 more, the 2 extra visits will need to come to as an EOI application on the actual website, and then the outreach team will approve that, and it'll come to as a variation to a contract, which you'll need to sign before the service is actually performed. So any additional visits, as mentioned, will need to be signed as a variation. Next slide, please. In terms of service changes, we request that you communicate these to us. So notification of a cancelled visit prior to the date of the scheduled visit, or as soon as known. Changes to your contract, please notify RWAV as soon as known, and include any documentation required. So this will be a new specialist being added, a specialist being replaced, a location of service being changed if you can't go to a certain location and it's a new location. Any key contacts that are changed on the contract. If you can let us know, that would be great. Or generally a general inability to perform the service for any other reason. For example, power outages, internet was down and you couldn't do a telehealth service. Those are just examples of those. Next slide, please. In terms of the documentation required, so we request that you submit all documents required within 1 month of being requested. Big change here. So for the Indigenous programs, specifically for treating vulnerable people, which is the main test in Victoria, which we have to undertake as for our organization. We request that the police check is submitted no later than 3 months from the issue date. We've changed this in this period where it used to be an annual police check. Now, if you submit it within 3 months from the issue date, this will be valid for 3 years from the issue date. What we will do is we will ask you to annually for the 2 years in between the 3 years to sign a supplementary annual declaration signed by the contract holder stating that the service providers have not been charged and there's been no serious offences which may affect their inability to continue the service delivery. So that's a big change from the previous year. So what we do is we found that it can be quite basically cumbersome to actually get a police check every year. So what we're doing is basically we will allow you to submit a police check this year, which is valid from 3 months from the issue date, and then sign an annual declaration for the next 2 years. Then after on the 3rd year, we will ask for another police check. So the working with children check for patients under 18. This will be, for example, pediatricians will be mandatory. Valid till the expiry date, which is 5 years from the issue date. Your insurances, this will be your professional indemnity insurance and your public liability insurance, which will be valid till the expiry date. The difference between these two, I'll just reinforce because there was a lot of concerns regarding this as well. Your indemnity insurance is your insurance for your professional service. This will be for treating patients, for consultations, advice that is given as part of your professional service. Your public liability insurance, this is a scenario where you'd actually have, this would be a scenario where you actually have, it's a cover at the hosting site or facility. So when we have actually paid you a room hire fee and you coordinate your own hosting organization to undertake the service, we ask that you make sure that you are covered for a public liability claim. For example, if there's a hazard at the site, for example, a ladder is left as a hazard on the site, and the patient were to say trip and injure themselves, that we want to make sure that you are covered for a claim in that scenario as part of the hosting facility that you organized. So the next one is the cultural awareness training. This will be for the Indigenous health programs only. Um, and we request that you provide us with the cultural awareness training, and this will be valid for 3 years from the issue date. Also, in terms of the new environment, the COVID-19 vaccination certificate. It's a reminder for the third dose. Healthcare workers eligible for a third dose on or before Wednesday, 12th of January 2022 will have until Saturday, 12th of February 2022 to get their third dose. Healthcare workers not eligible for a third dose will be required to have their third dose by no later than Tuesday, 29th of March 2022. So for an instance where we can't actually get the COVID vaccination certificate from you, the service will be put on hold until RWAV receives the confirmation of vaccination certificate. Because in terms of for RWAV, the risk, we need to let the hosting facility know that we haven't received confirmation that you're vaccinated, and they need to be prepared for that. And also for our own um, risk purposes, we will need to know that you are vaccinated before you attend the site. Next slide, please. Just general feedback in regards to service reports from what we've noticed in the last financial year. So a session is 3.5 to 4 hours, so which is equivalent to half a day. So if you have 2 sessions, it's actually a 1-day visit, which is 2 half days. The travel distance. So what we request as well when you're raising your claim on the portal, if you have car travel on there, and say, for example, if you had 744 kilometers on your contract, we ask that you claim the whole amount or whatever you've actually traveled. So what's happened previously is a couple of people who submitted service reports have put in one. Essentially what you're going to get paid is 72 cents in that scenario, because 72 cents is the rate. And we request that if in the contract you're eligible for 744 kilometers, if you've traveled the whole distance and you want to claim that, you put in 744. If you only traveled 700 kilometers, then you put in 700 kilometers and you get paid at 72 cents per kilometer. In regards to the changes to the contract, we're required to seek approval from the outreach team prior to the submission of the service report. So for example, if you do an extra session, which is not on your contract, so if you're only eligible for 2 sessions and you do a third session, basically the outreach team will check to see if they have the funding to support that. In a scenario where it is a one-off, where the outreach team will say accept it, and then basically that will be paid. But if it's an ongoing thing and you're planning to do 3 sessions till the end of the financial year, that would need to be a variation on the contract. So essentially, those are the sort of things with one-off claims and recurring claims. So recurring claims will need to be a variation. A one-off claim, we request that you get in touch with us to actually say that you've done an extra session. A car hire. Basically, if you are claiming car hire based on a reimbursement basis, you provide us with a copy of the receipt of the car hire, and this can be attached on the attachment field in the portal. If you have a health professional who is planning to visit and is not on the contract, we request that you actually send us this confirmation, because they won't be shown in the portal until RWAV has actually added the specialist on. So this is a risk for us as well, because we need to make sure that they're vaccinated before they're added onto the contract. And so, for example, additional lunch that may be claimed as an example as well. So please sign and return the variation agreements within 7 days. We give you a period of 7 days to actually sign the letter. If there's been a miscommunication in the variation, for example, it allows you to read the letter and to sign it. After the 7th day, we will execute the variation, because essentially what we'll do is this will stop the contract from processing. So we'll actually, any payments that are coming up will be processed at the new rate. Next slide, please. I think that's all from the compliance perspective. Back to you, Cher.
Thank you, Nalan. This section will be focusing on the 22-23 outreach service funding, and I will actually hand over to Candice to walk us through this section. Thank you.
Thanks, Cher. So as Cher mentioned, so this section will be all about the funding round for next financial year and just the process and timeline, just to go through that briefly, and then also have a quick walkthrough of what the next funding application form will look like as well. So just to give you a bit of a timeline from where we are now and where we will be for the next financial year. So we're currently in February, and we'll be looking at launching the 22-23 outreach service funding round next week. So as of next week, you'll receive some communication from the Vic Outreach team with some information on how to apply for funding for next financial year and some further instructions. Also, as an option as well, we will be having one-on-one support meetings available. So it is a new process, it is a new form, so it will be a little bit different to how we have done it previous financial years. So the team is here to support you with your applications as well. So definitely feel free to reach out to us if you do have any questions about the application and the form. And then in March, so the funding round will be open for about a month. It will close around mid-March, and all the applications will be assessed by the RWAV outreach team. And in April, all of the applications that we have received and all the service providers and host organisations will be notified of the outcome if they have been accepted or rejected. Accepted applications will be submitted to our Victorian Outreach Advisory Forum for approval. And then once that's been considered and endorsed, we're able to move it into the next step as well. So in May, this is when we have our larger Victorian Advisory Outreach Forum meeting. So this is early May, and this is where we seek the endorsement for all of our proposed applications in all of our programs. So it's a really busy time of the year for us to make sure we've got all the services planned and organised for the following financial year. And then this process is basically for them to endorse the proposed applications. Those that have been endorsed by the VAF will get a notification of success that they were successful with their application, and they'll be notified with a letter of offer, and then we'll move into the next steps with the contract in terms of getting the due diligence information, just to make sure that we still have the right key contacts on the contracts, and if there's anything that's been changed over within the year, that we can get up-to-date information there as well. And then the applications that are endorsed in May by VAF, they then get submitted into our activity work plans to be sent to the Commonwealth Department of Health for approval. So that does happen at the end of May, early June. And then once that happens, we're able to then start getting the contracts sent out. So contracts should be, once they've been approved, will be sent out in June. And then all the compliance documents will need to be returned and signed to RWAV within 2 weeks. So Nalan will be following up on that. And then in July, that will be the next round of the stakeholder information sessions as well. So a bit of a timeline and overview of what's happening over the next few months with us as well. So some good news as well. So next financial year, there'll be a slight change to some of the contracts as well. So we are looking at changing some of the contracts from being not just a 1-year contracting period, but we are going to be doing 2-year contracts as well as of next year. So definitely this is really some good news for existing service providers. So the 2-year contracts will only be applicable for existing services, and any new services that are coming through for the next financial year will commence on the 12-month contract and may be eligible for the 2-year contract after that, based on performance and contract throughout the year as well. So next slide, thanks, Cher. This is just a bit of an overview of some of the assessment criteria for stage 1 eligibility of the contracts or the applications that we assess. So we work off our assessment criteria that is supported in the service delivery standards for the Victorian outreach programs. So there is 9 different criteria. It is slightly different to our RWAV program. So if you're across both programs, they are a little bit different. The main difference between the two is that there is the need for the cultural appropriateness within in the Aboriginal and Torres Strait Islander programs, being the 9th criteria as well. And if you wanted to get more information on this, it is accessible on our service delivery standards, which is on our outreach website as well. Next slide, thank you, Cher. So the next is part of the assessment criteria, which will be for the stage 2, which is where we do the funding assessment for it. This will be based on the further information that we'll be collecting in the application. So around the waitlist times, if you've got access to that, wait times for new patients to be seen, ability to meet the contractual requirements, so submission of visit report and required documents within agreed timelines, visit cancellations, bulk billing practices, alignment with RWAV need assessment, and also the funding allocation for the disciplines within the program. So we do have sort of, I guess, mini allocations within the programs depending on what disciplines are in there. So we need to make sure that we have a fair range of disciplines with the funding in each program as well. Next slide, thank you, Cher. So the next part here, we might just change over the screen. So I'll do a quick walkthrough of what the application form looks like, and we'll spend probably the next 5 to 10 minutes just having a quick run through with that. If there are any questions with the application form that you have, I'm more than happy for you to write those down in the chat box, and we can go through them towards the end of the session during our Q&A session. So hopefully you can see that on the screen now. So this will be available as of next week. So once the form is up and live, you will get notification that you're able to complete the form, and you'll be directed to this page here. So you'll start off filling out the outreach funding form with your email address, so contact detail there. And then there's a few different series of questions that you can go from. So the first step is when you're filling out this form, if you're applying as a host organisation. So if you're, an ACO, you'll be clicking on that, or you might be a service provider providing services to the ACO. So you would click on it depending on what way you're applying for the funding. So we might go for host organisation in this instance. And there's 5 different sections in the application form. So we've got the first section, which is the application details. So in here, this is where you'd put in the details of the organisation and the address, and then just the contact details there as well. So pretty straightforward information in this bit here. The only thing that we need to really make sure that we're collecting accurately here is if you're the organisation that will be the host for the proposed service, or if you'll be the organisation delivering the service as well. So depending on what that is, you'll just fill out the different details in there too. And then there's also a requirement just to provide a brief overview of the proposed service, and just, whether that will include consultations. Will, if you're a dietitian, is it going to include some, some group, consults? Will you be doing some cooking classes? So you can get really creative with this, just give us a bit of an understanding about how the service will work when you're on site. Also, if you are wanting to propose for new services, this is an area where you can actually say if you've identified a service provider or not. So definitely encourage you not just to apply for existing services that you have at the moment if you're an ACO or a host organisation. If there are services that you would really like to have funding for next financial year that you don't currently have, definitely still fill out the form as well, and we can do our best to help you find service providers for this. So you can just let us know in the case whether you do have a service provider or not, and then we're able to support you in that instance as well. So you're happy to accept any applications that you have any ideas for. The next section here is the section B. So this is around the evidence of need. So this is for us to gather some information around the need for the service. So if you could provide some examples for the specific needs. So, if it's a dietitian, you might be going to provide a range of consults. There might be, you might want to do some focus groups on that. So it can be really depending on what the need is for the community. And then what services in the discipline are already in the community and or the region. So you might say that there's a dietitian at the hospital, but there's not one that's locally accessible for the community as well. So just a bit of more information on that. And then if the service links to any other education, state or Australian government funded programs in the region as well. So just for us to really understand if there's any other linkages within the community. And then the next section around here, there's a few sections where you can just click on what's applicable. So it's around the waiting list time. So if you know the wait list, you can just click on which one fits in best for you, and then how many patients are on the wait list, and then what's the waiting time for a new patient to be seen. And then there's just a couple of other questions around if outreach is the best fit for the community and if there's if self-sufficiency has been explored as well. So those ones are just sort of yes or no answers there as well. The next section is around the service details. So will the health professional conduct the visits on-site or off-site? So it's more collecting the information of how the service will run, and if it's going to be bulk billed, if there's going to be a fee, or if there's both. So you might have a split of, bulk billing and fee for service. It can be a range of that, but I think most of the programs with the Aboriginal programs will be bulk billed model. And then will the proposed outreach services be delivered by a salaried or non-salaried health professional? This is important for us to know whether the position will need backfilling support. So just answer it to the best ability. And if you do have any questions, definitely reach out to us and we can guide you around these questions as well if you're not too sure. And then once you've filled out that, there's just some information around the address of the health professional where they're travelling from. This will help us understand how we need to cost things like car travel allowance or away from practice allowance. So if you know where they're based, just pop those details in there and we can complete that for you. And then if the health professional will be using their own vehicle, and then if they provide professional support as well. And we've got some information around what professional support is there as well. The next section is around the additional service details. So just giving us an understanding of how many visits you're wanting for the financial year on site and then off site if you are doing off site as well. So that would be telehealth. The number of sessions per visit. So whether that's just a half day visit or if it's a full day visit. So just keeping in mind the session is 3.5 to 4 hours approximately. And then if you need room hire fee, admin support, if there's a registrar attending the visits as well, and are these funds, if there's any other funds received from any other sources as well. And then the next section is more around the declarations if you're able to comply with the compliance requirements of the program. So just around that the organisation and health professional have agreed to invoice RWAV within the 30-day period, confirm that the health professional and the organisation can provide the service reports with the patient numbers, and then the health professional is registered and licensed with the state or territory that provides the registration or license for the health professional. So just a few yes or no questions. There's a couple of areas as well around attaching if you've got your current CV or if you've got the CV of the health professional, you're able to attach that there. So you just click on the little bit there and then you can just drag and drop it in there. And then same with the next section as well. There's also the provide a letter of support from the organisation, and you just would click on the paperclip there as well and just attach something there. With the letter of support, we're happy to give you some more information if you need. We can provide some examples of what that might look like, but just a statement from the host organisation that the need for the service is there, a little bit of intel around the community need, what the wait list is like. Something really simple is more than enough just for us to gather that information and that you're happy to support the service funded under RWAV as well. And then the next few things are around if you agree to the privacy policy, obviously we do have to collect some information as a part of the service reporting. You are able to click on the little link there as well if you'd like to have access to the privacy policy details with RWAV. So you can just have a read through there if you'd like. And then if we go back to the form, and then it's just confirmation that you've just read and understand the program guidelines, you're also able to click on that link there where it says click here, and it will take you to our outreach program page. And there are service delivery standards under each of the programs as well. And also the needs assessment report from September, which you can access there if you wanted to have a look at that too. And then finally, that you just declare that all the information supplied is accurate and applicable at the time is true and correct. And then you'll just click submit and then that will come through to us. So that's just a quick overview of the form. So we'll just go back to the PowerPoint slide. Thanks, Cher. And then just to follow up on that, please note that there will be one-to-one support meetings offered. If you would like some support, definitely you can reach out directly to us over the phone. Preferably if you were to email us at Vic Outreach, that way Kaz can keep a track of it, and she's sort of our gatekeeper in the outreach team, and she can allocate a time for us to catch up and have a meeting. And then in terms of the application, you will be notified of the outcome via email in April. So definitely you will hopefully get receipt that you have submitted the application, but just do be aware that you won't probably get a further update until April. So just if you have any concerns, just reach out to us and we can kind of give you an update. And then the service delivery standards and RWAV needs assessment are accessible on the website. So you can go to our Vic Outreach website and the page, and you can click on the service delivery standards there if you wanted some further information. So I think that might be it for me. So I'll pass it across now to Sarah, who'll provide some further updates.
Thank you, Candice. So just a little bit about further updates at RWAV. So we've got a few professional development grants available. So we've got the Pain Management Grant, the Health Workforce Scholarship Program, Rural Allied Health and Nursing, Rural Practice Training, and the Medical Professional Development Grant as well. So you can have a look at more information for these on the RWAV website on the grants page or on the RWAV social media. Or alternatively, you can also send an email to vicoutreach@rwave.com.au if you'd like a little bit more information there as well. We also have a grants week next week from the 7th to the 11th of February, which you can find on the website to sign up for a webinar information session for those as well if you'd like to find out more information. And then moving on to the expression of interest, the EOI application. We're inviting any additional visit requests to be submitted, but these do have to be conducted by the 30th of June this year. And then also have the recruitment of outreach service providers. So we've got a focus on speech pathology, ophthalmology, mental health worker, psychologist, and psychiatrist as well. So if we go on to the next slide for next steps, yep. So as we mentioned, we've got the launch of the 2022-23 outreach service funding. So this email will be sent out next week. So you get an email around that, and it will be open for a month. So you can submit your application through within a month. We'll be having any follow-up one-on-one meetings if you've got any questions or would like any further information. And also, as mentioned, we've got the invitation for EOI applications and also the professional development grants that you can apply for. And also, so the next stakeholder information session will be in July this year. And just to help with developing the topics for this information session, we will have a short evaluation survey for this session sent out sometime next week. It will just have 3 questions in there for you to fill out, and that will help us with developing the information session in July. And all documents and recordings of the presentation will be accessible on the RWAV website as well.